Welcome to Mount Sinai Future You, a show highlighting innovations and research at Mount Sinai that are changing patients' lives. Spinal cord injuries can cause paralysis, robbing people of their ability to walk, run, or even dance. But one man has refused to give up. With the help of a new technology, he was able to compete in a prestigious race along Fifth Avenue, just blocks from Mount Sinai.
In a way, I've almost become grateful that it happened because I think it's kind of like a definite trial for my life that'll kind of chew me up and spit me out stronger than I was before. I was at a funeral of a close friend of mine, and on the last night we were driving back, the car crashed into a tree and I was thrown from the back seat into the front seat. I remember waking up in the hospital and they told me that I was paralyzed.
That he had a complete spinal cord injury at the T3 level, which means that he had no sensation or motor function below his upper chest.
Vocal cords were paralyzed, my tongue was paralyzed. I couldn't eat or drink for like 2.5 months. I couldn't talk. Then I had a breathing tube in my mouth for like 3 weeks, which was probably the worst part of everything.
When someone's first injured, all they can see is what they've lost, what they can't do, who they're not anymore. He's a free spirit, and the last thing he would ever want to feel is confined. 27
years old, really active person. You know, I like to play sports. I usually walked about 20,000 steps a day. I had a job as managing a restaurant. I like to travel around the world and do stuff, so living in the city, not being able to use the public transportation, I mean, it's the hardships originally of being in bed and wanting to go to the bathroom, and the bathroom's right there, and then you just can't get up and go to the bathroom, is definitely something. Even though I have setbacks, I'm not giving up hope. First I started at Mount Sinai doing the exoskeleton, and then I moved to the VA where I'm part of a rewalk clinical trial. So I do that 3 times a week, which is great, and I can feel the benefits, and it's just good to kind of be standing up on my feet.
The exoskeleton program that we have here at Mount Sinai, I think is critical. It's a robot that is kind of fitted to the outside of the body, which moves the legs and allows someone to be upright and to move about.
When you're first injured and you're sitting in a wheelchair, you're literally looking up at the world, and the world is literally looking down at you. And that is depressing. I can't underestimate the power of being able to stand up and look at someone eye to eye is beyond powerful.
Mentally, just being on my feet and moving my legs just kind of, it feels, I feel whole again. I've been training for months, with really no purpose besides just getting myself better, and then out of the blue I'm told that I get to participate in this Fifth Avenue Mile, which is this prestigious race in Manhattan. This is the first year that they're going to have people in exoskeletons do it, and for me, one of the things I've lost is kind of being able to be competitive and in that, play sports and do stuff like that. So just being able to get out there and competing like everybody else.
Peter went from not being able to talk or eat or even sit up in bed, and a year later, there he is crossing the finish line in an exoskeleton and actually winning the race. It's absolutely amazing.
Anybody who's suffering from something that seems bleak and chronic, I think it's important to not only just to keep pushing yourself, but to understand that the science and stuff is changing so fast that you should never not give up hope, because in 5 years it's going to be totally different than it was.
I believe once people are using it in their home, I think this will be transformative for people who have spinal cord injury.
From the mile run along Fifth Avenue to a full marathon in New York City, one young man with a passion for running is refusing to let Crohn's disease hold him back, and he's sharing that passion with the physician who treats him.
I was diagnosed when I was 14 years old. It was a year after my father passed away from kidney cancer, and it was a very devastating loss for me and my family. I had been suffering from unexplained stomach pain for about a year. Stomach aches 20, 30 times a day. I couldn't sleep at night because the pain was so bad. I'd feel nauseous. And it turned out that I had Crohn's disease.
We met him when he was 14. He was a young adolescent who looked much younger than his age. He was short. At 14, he only weighed 81 pounds.
There were many times where I felt, gee, I just wish I could push a button and make all the symptoms just disappear.
Crohn's disease is a chronic disease, and it impacts how you're growing, how you're feeling. There are some studies that show that the disease worsens at times of stress.
But when I finally got an answer to what was causing my pain, it came as a great sense of relief.
In certain patients, it takes us a while to get the right combination of medications. Once we had the right treatment for him, he flourished. He decided he was going to run a half marathon.
I told Dr. Benkov how much fun it was and how I had improved from not being able to run at all to being one of the students who was the fastest at the school. So he immediately asked me, well, Evan, do you want to run the full marathon with me next year? And so I did. And since then, I've never looked back. Running feels amazing. I consider it a part of my medication. To feel the wind on your face, and it doesn't matter if it's freezing outside or if it's snowing, it's just the feeling of flying and taking your body to its limits. Dr. Benkov is really a selfless guy. He's been something of a father figure for me since my dad passed away and since my diagnosis, and he's taken such great care of me.
We're really looking forward to some, huge advances in effective therapy in the next 3 to 5 years. He eventually will benefit from the new therapies.
It's very important to stay positive. I've always remembered that I have the support of my family, my doctor, and I do feel lucky about that. I am so thankful for Dr. Benkov and what he's done. He has changed my life. He has given me my life.
Evan says he plans on running many more races in the future. Crohn's disease was first discovered at Mount Sinai, and it continues to be a focus for the health system. Dr. Marla Dubinsky is chief of the Division of Pediatric Gastroenterology, and she specializes in treating children with Crohn's disease. In this week's In Their Own Words segment, Dr. Dubinsky talks about the importance of building a strong relationship with her patients and their families.
I always envisioned taking care of children. And then during my pediatric residency, I became attracted to patients with Crohn's disease and ulcerative colitis. Crohn's disease itself was actually first discovered at Mount Sinai. Dr. Beryl Crohn started and really was the lead in the efforts for Mount Sinai to figuring out what are the causes of inflammatory bowel disease, how to develop new treatment strategies, and better care paradigms. I take pride in the fact that my care is very holistic. It's really a 360-degree approach to the management of IBD. What I like to do is develop a partnership with the family to say, let's start this therapy, let's make sure that it's working, so that if it's not working, I can quickly pivot. The introduction of biologics has made a huge impact in the lives of both adults and children with inflammatory bowel disease. The next 5 years is going to be filled with even more new biologic strategies. I think we owe a commitment to the community as being the hospital where Crohn's disease was discovered, that I feel, along with my colleagues, we have a sense that we need to really figure this out. My hopes for my patients are that I can restore their resilience. I want them to be able to go through college, be able to be successful in their careers, be able to have a family. I want them to be able to resume all of the things that they ever wanted to do and not let this disease define them.
With only minutes to spare, one baby girl was given a second chance at life. She was diagnosed with a rare heart defect, atypical hemolytic uremic syndrome, which affects only 1,500 people worldwide. Her parents share her emotional story.
The heart rate monitor read 250 beats per minute. I could see her heart coming out of her chest. She was dying in my arms. I told Jordan, I said, we're gonna lose her.
Brooke was transferred to Mount Sinai with literally minutes to spare. She was at death's door. She had arrested. Her heart had stopped beating at another hospital.
Babies are beautiful. She was a beautiful baby, even in that moment, but she wasn't breathing on her own. She was a collection of signs and symptoms. She had anemia, she had heart failure, she had high blood pressure. She was completely reliant on technology to keep her alive in that moment. But she had no diagnosis, so when she came to Mount Sinai, she was essentially undiagnosed.
Dr. Salen got it right away, treated her right away, didn't hesitate, didn't wait.
This is a disease that probably 15 years ago would have been uniformly lethal. Jeff was the first pediatric nephrologist to come up with a definitive cure for this disease.
I think it's fair to say I have more expertise dealing with atypical HUS than the majority of pediatric nephrologists in this country and the world. So that by the time this patient came here, I knew what to do. I knew how to recognize it. And that's not necessarily true at every other hospital.
It's a very new drug and a very expensive drug, and that just wasn't an issue. He just said, she needs this drug, we're gonna try it and see if it works.
We met almost 100 doctors, and no one was able to help us. They referred to Brooke as a mystery case, the mystery child. And it was so heartbreaking for us because we didn't want that child who couldn't get help. She got a second chance at life because of Dr. Salen.
3, 2, 1, awesome!
I didn't think we'd have this day. I didn't think I would have 2 children like I do today. I'm so grateful every day.
The miracle of this case was that we had an infant at death's door, and that we were able to really quickly get a very, very specific, ultra-rare diagnosis right within a few minutes, get the right treatment, and put her on the path to recovery.
A lot of people ask me, how did I deal with what I've dealt with, and how do I deal with it today? And it's truly because we have Dr. Salen and the team at Mount Sinai. And that's how I'm able to sleep at night. It's because they're watching over her.
Bundle branch block is a congenital heart condition that causes electrical impulses in the heart to misfire. Now, a person with this condition often needs a pacemaker to keep their heart in sync. Cardiologists at Mount Sinai are using a recently approved tiny wireless pacemaker in kids so they don't miss a beat. One teenager from New Jersey with a passion for travel and adventure says the device is allowing him to live life and have fun without worrying about his condition.
We always had that, crazy travel sense. We've seen every state. We like to go to Europe a lot. And we kind of do it so that it's affordable because there's 6 of us. So it's a congenital heart block. My mother-in-law, who passed away 3 years ago, she had 27 pacemakers. So she literally, it just had a full block. So they had to keep putting pacemakers in. These guys have partial blocks. 3 out of 4 of our kids have partial blocks.
So Sam is very interesting in that his family has a condition called acquired heart block, and it's a familial condition. The condition is present in some of Sam's other relatives as well, and again manifested in his brother as a conduction problem and manifests in him as a conduction problem.
I had the 2 kids, knowing that my mother-in-law had this condition. When they were young, I had them tested. And so the doctor said, yeah, they have right bundle branch blocks. And he didn't think anything of it. He just said, okay, whatever. And it wasn't until we had a cardiologist friend who said, you really need to go to Mount Sinai. They're the best. They're the ones who are going to be able to detect whatever's going on, and they'll take care of him right away.
We can see that on his electrocardiogram that the upper chamber is starting to talk to the lower chamber in a difficult way. The communication is getting a little bit longer. It's getting a little bit more difficult to communicate between the upper and lower chamber of the heart. And we expect that one of these days that will stop, and what we're concerned about is that could stop abruptly and he could faint or have even more serious consequences as a result. And so because of that, our desire was to put a pacemaker before he reached that stage.
Of course it was hard to hear and just had to do it, but we felt much better that it was in, knowing that he was safe just in case. Sam's is ridiculous. It's this big. You had to put in over here, and he, I guess, let it up, and he says it's in between the chambers. It's totally wireless.
Sam, in addition to having this familial heart block condition, also has a condition called idiopathic thrombocytopenic purpura, or ITP, which basically means his platelets are low. His own body chews up or sequesters his own platelets, and so the platelets are required for clotting. And one of the concerns that we had as well was that if we make a pocket, an area where we put the pacemaker in, if there's not good clotting, it can lead to bleeding in the pocket, and that can lead to risk for infection. And so we were somewhat concerned with Sam, including all those other risks for pacemaker, with also having a standard pacemaker for him as well. And so this new pacemaker, the Medtronic Micra, has just been released recently, and what that is it's a pacemaker that's the size of a pill capsule, basically. And that pacemaker itself is inserted directly in the heart. There's no wires. The entire pacemaker itself is all self-contained within that small capsule. That's put in from the vein at the top of the leg. We go up to the heart. We put it into the heart, and it's held into the heart with little tines, little wires that hold it into place in the heart. And it does all the same function of the pacemaker, all condensed into that one little apparatus.
It's pretty cool. It's I mean, it's small, and you didn't even need to go through the heart, and it was pretty cool. It doesn't bother me at all. I haven't noticed it since I left.
And he was able to do whatever right after.
So it's very gratifying to see patients doing well, especially after a new procedure. Sam's mom had sent me pictures of him on the baseball diamond not long after his procedure, and he was back to his usual activities really very, very quickly. With the standard pacemaker, even though it's small, there's a small scar over the chest. Every time you look in the mirror, you are reminded of the fact that you have a pacemaker and that you're sick. In this instance, there's no reminder, there's no scars, there's nothing to remind you that you actually have anything wrong with you at all. And I think from a psychological standpoint, it does make a difference.
You realize that life's short, and you really got to make sure that you're not just sitting around saying, oh, sick, poor us, or whatever, that you're actually having fun. So I think we overcompensate. We do more than I think normal people, because we want to make sure that the kids are always having a good time. We were going through caves, swimming in caves, and they said, does anybody have any heart conditions? Anybody? These two were dove into the cave sooner than anybody. so I mean, it's right. I don't think it slowed us down.
Barbara Renda goes to the dermatologist religiously for skin checks because she's susceptible to skin cancer. But even with frequent visits, one small dry patch above her eye turned out to be undetected cancer. Dr. Harsha Reddy, an oculoplastic surgeon with New York Eye and Ear Infirmary at Mount Sinai, helped reconstruct Barbara's face after her cancer was removed. It was a difficult case because Barbara's eyesight was in jeopardy.
Never would have known. Never. It was a huge cancer, but completely undetectable. It was just a little dry spot on my eyebrow. It was really nothing too noticeable.
Barbara Renda had a dermatologist check out that spot a handful of times over the course of a year, and that doctor kept telling her it was just a dry patch. But her daughter knew it could be more serious and pushed for a biopsy. The results showed skin cancer.
It was all inside the skin. You couldn't see it at all. It was an 8-hour surgery. She kept cutting and doing the biopsy, coming back, cutting again.
When I saw her for the first time after the skin cancer removal, I was shocked by seeing a baseball-sized defect on the side of her face and the eyelid. So that was alarming to me. It was really large even for what we usually see, and it was much larger than what I expected.
After the skin cancer removal, Dr. Harsha Reddy of New York Eye and Ear Infirmary of Mount Sinai had to do a complicated reconstruction.
The defect is a hole in the side of the face, from starting all the way in the top of the forehead and working down to the eyelid. And of course, this is her only good eye, so this has huge impact for her life to repair this well.
3 years earlier, Barbara lost her left eye from a retinal detachment, so she's now living with the prosthetic. And since the skin cancer grew onto her right eyelid, Dr. Reddy knew how critical it was to protect her only source of vision during the procedure.
The skin cancer itself can be quite devastating if it spreads to the rest of the face. And then the defect that's left after it's removed can also be quite devastating for the patient. She may not be able to close her eye. This could affect her vision. She may get infections around the eye. She may be in constant pain. Now, all of this in her one good eye. So I had a lot of challenges to anticipate during surgery. And when I was doing the surgery, one of the most important things was to not damage the facial nerve, which if I had affected the facial nerve, she would not be able to close her eye, and she would have an appearance of having a stroke on that side permanently. So during surgery, I had to be very careful to minimize any kind of bleeding and to move the tissue in a very gentle way such that that nerve would not be damaged at all.
One mistake, one slip, and he could have destroyed the eye.
That was Barbara's biggest fear. She thrives on being active, and she's also heavily involved in the lives of her grandchildren. So to her, losing her vision altogether would have been losing everything. She's grateful Dr. Reddy made sure that didn't happen and saved her sight.
The vision, of course, is the most important thing. So she's able to see, she's able to enjoy all her activities and her time with her family, and no pain, no infection. She's doing great.
Dr. Reddy is so good at what he does. He saved my vision and gave me a new lease on life, really, because it could have been a very different scenario.
Scientists at Mount Sinai have developed a new pathology test that uses artificial intelligence to accurately predict prostate cancer progression following surgery. The technology includes machine learning and specialized microscopes that are housed at the Center for Computational and Systems Pathology at Mount Sinai. In our next segment, Pathology Chair Dr. Carlos Cordon-Cardo discusses how precision medicine is changing how doctors treat patients.
We have created a GPS like the ones that we have in our car. So we have used techniques of machine learning, deep learning, artificial intelligence to identify the blood vessels, it's the connective tissue, it's the cells, are the glands. So if you can see it, we can give it a mathematical formulation. It's not opinion anymore. It's not what I believe, what you believe, it's what it is. It predicts disease course and outcomes with an accuracy that's beyond what we have been able to do with the tools that we have today.
In prostate cancer, the primary method that clinicians use to characterize a cancer and basically decide on a treatment protocol is the Gleason grade or the Gleason score of the patient. Over the years, though, it turns out that we have overtreated prostate cancer by quite a bit. So the idea of having cancer leads a lot of patients to decide on radical treatments, namely surgery. What we're trying to do is characterize prostate cancer more effectively than just by using the Gleason score. Google might use similar techniques to characterize facial properties and allows them to do facial recognition software. We apply similar computer and engineering technology to images of cancer. How separated are the nuclei from one another? How big are the nuclei? What protein markers do those nuclei contain? And so we characterize these images with complex methods and we extract these features out of them. Now, once we have the features, we use these artificial intelligence type approaches to then take all of that data and figure out what combinations of those features do a better job of predicting the behavior of the cancer than Gleason alone.
So these tools allow us to produce a very assertive approach. Our motto is how to translate data into knowledge and then how we can manage this knowledge in order to better manage our patient and understand healthcare.
This year marks the 50th anniversary of the Icahn School of Medicine at Mount Sinai. The school's journey began in the late 1950s when the Mount Sinai Hospital started its own medical school and graduate school. In our next segment called Alumni Pride, Dr. David Rich, Icahn alum and President and Chief Operating Officer at the Mount Sinai Hospital, shares his journey since graduating from medical school.
Well, Mount Sinai was a very different place in 1984. It was really exciting to move to New York and to be part of something that was such an incredible enterprise. It was a very epic moment in my life. It was a time of learning, and it was a time of change, and New York was evolving, I was evolving, the residency was evolving, and anesthesiology was changing dramatically at that time. When I walked into the operating rooms at Mount Sinai Hospital, there was no such thing as a pulse oximeter. And over the course of the 2 years that I was a resident, anesthesia changed dramatically by the introduction of end-tidal carbon dioxide measurement and pulse oximetry, which drastically changed the safety profile of the profession. I've been blessed because even early in my career, the leadership of the institution was willing to invest in equipment that allowed us to computerize the operating rooms in ways that were very much ahead of their time. I hope that being chairman of a department that was able to advance the science of anesthesiology and to provide safer and safer care was one of my huge achievements, and taking the knowledge that I gained in creating advances that were in the interest of patient safety and carry that into a hospital presidency was a natural progression for me. Well, the times really have changed at Mount Sinai. When I arrived, it was largely Caucasian Jewish men, and that was the staff, and that was the residents, and those were the students. And we have evolved in a wonderful way. As someone myself who identifies as LGBT, for me to have risen to a position of leadership would have been unheard of 20 years ago, maybe even 10 years ago. But Mount Sinai was always willing to look beyond labels and to establish a true meritocracy. Icahn School of Medicine at Mount Sinai, you made it. 50 years. The next 50 years, we're really going to see some amazing things.
Thank you for watching Mount Sinai Future You. Be sure to follow us on Facebook and Twitter for updates on our next episode.